Swallowing has become more and more difficult for me. I have come very close to choking.
I don't have any dexterity left in my hands. I can't close my fingers up very well.
Right into the puddle, right on Main Street. My whole body was traumatized. I was embarrassed.
It's scary to think that eventually you're going to be 100% dependent upon somebody. A fall could end everything.
Sporadic inclusion body myositis, or sIBM, is a rare, devastating inflammatory and degenerative disorder. It is characterized by a slowly progressive asymmetric atrophy and weakness of both proximal and distal muscles. Patients gradually lose hand function and the ability to walk, experiencing falls and injuries. They may also suffer from swallowing difficulties, which can lead to death from choking, aspiration pneumonia, and malnutrition. For patients with sIBM, the loss is both physical and profoundly emotional.
I'm Charlie Cleaves. I'm from Sangerville, Maine. I'm 59 years old. My brother and I run a second-generation potato and grain farm. In 2001, I started experiencing a weakness in my legs, and I couldn't get up. I got to the point where I was stumbling, falling down.
He started with his primary care doctor. He had a variety of different tests, but we ended up going to a neurologist, and a variety of tests were ordered, and eventually the biopsy was done. In all, Charlie has seen 3 neurologists.
It was very discouraging to go have all the tests come back well. They didn't know what was going on. Finally, in 2006, it was diagnosed that I had the inclusion body myositis. My left side is very weak. Now I'm to the point where I feel uncomfortable walking any kind of distance.
My name is Julie Milo. I'm 66 years of age, and my husband Larry and I own a plant nursery. I was diagnosed with sporadic inclusion body myositis in 2003. And I noticed that I was falling, and it was harder and harder for me to get up. I would fall at strange times. I was finding steps very difficult. Blamed it on my bifocals. We were attending our granddaughter's basketball game, and I was going up the bleachers, and I fell backwards trying to go up the steps. And my children said, "Mom, you've got to see a doctor." He recognized that I had a problem but wasn't sure what it was. He sent me to a neurologist who said that there are several forms of myositis, and to specifically diagnose sIBM, it would need a muscle biopsy, and that was done, and consequently it was diagnosed sIBM.
I wanted to cry, not so much for myself, but for Julie. And we didn't know what was coming, but I also started feeling sorry for myself, thinking that we're going to get gypped out of the life that we were experiencing.
The pathology is characterized by some degree of inflammation and some degree of degeneration. This is a chronic, progressive muscle disease for which there is no clear cause and there's no proven treatment.
It started mostly in my legs. I don't have the strength when I go down to pull my feet out from under me. Consequently, I hyperextend my toes, and I have probably broken all of them at one time or another. My hands started to deteriorate, and my small motor skills were getting weaker and weaker, and now I can't even make a fist with my hands.
I have bought pieces of equipment here in the last 3-4 years that I've never even sat in the seat of because I can't operate, and I miss that. I can't now get my socks on anymore or my boots, so I have to wait, and until she gets me ready. In the morning, she has to dress me, and right now, she washes me. I was down to the shop here where we're going to be heading in a minute, and I was trying to hurry. My legs just collapsed, and like I said, I have no control when I go down because of this muscle disease I have. And my legs collapsed, and I struck right on my left shoulder, and it broke the bone between where my arm hooks to my shoulder.
Buttons, big or small, are impossible. I cannot do them. Zippers, I cannot tie my shoes.
It's a pretty solitary life. It's he and I. Friends' homes aren't handicap accessible. So unless they come here, we don't see them.
Usually people are devastated. Most patients are concerned about their progressive loss of function.
The hardest thing for me is not being able to be the grandparent. I can't take care of my grandkids. I can't interact with them. I can't take them to a movie.
Well, I think about, what I miss the most is running equipment.
Every move I make, whether it's putting one foot in front of the other, whether it's responding to somebody who's talking to me as I'm walking, I have to think about it. Nothing is automatic. That thought process drains energy.
The disease can be life-threatening in several ways, especially in its advanced phases. For example, frequent falls become very common as the disease gets worse. Most people with IBM develop difficulty in swallowing for liquids and solids, and this can be very dangerous because they start coughing during meals and then choking. This can be life-threatening.
Swallowing has become more and more difficult for me. I never take a bite of food without having something to drink. I have come very close to choking.
Well, I'd like to say normally we try to eat food that is soft. I'm very careful not to get out anywhere where there's a possibility of falling where I'm alone.
I ask them to live one day at a time, try to cope with the physical disability by modifying their environment.
I could tell that Julie couldn't lift up her legs so far by herself, and I noticed that if I was there, it was easier for her to take that half step.
Cannot hold a comb or a brush. A pick I can hold in my thumb and my forefinger.
We've made some adaptations on equipment at the farm through handrails, more steps that are ground level, that are close together.
I haven't seen a patient where the disease has reversed or stopped. Most of these patients need some kind of assistance during walking within 5 to 10 years of the diagnosis. Eventually they will need, many patients will need a wheelchair.
To watch everybody else having fun doing the things that I want to do is very difficult. I have not looked into the future whether or not the time will come when I can't hold my head up, but it's a possibility, I'm sure.
My worst fear is becoming to the point where I can't get out, I can't drive, I can't leave the house, I can't be independent.
He is often telling me, if I'm here in a year, we'll do this, or next year, if I'm here, I want to. And I mean, I don't think people in their 50s usually talk like that.
You have to adapt to what you're given. If I'd had a choice, obviously I wouldn't have this.
We take it one day at a time.
sIBM is a slow and relentlessly debilitating disease. Despite the bleak prognosis, many patients remain hopeful that they will one day be able to rebuild their strength and regain their function.